Thank you, Miss Pam, for agreeing to be here with us today.
You're so welcome, Miss Sharon. Hey, Jermaine.
What we'll begin with is the opportunity for you, of course, to introduce yourself and tell us who you are and all that great stuff and all that you would like to share about University of Maryland, your role, etc. And then providing any information that you would like to that would be relevant for our participants once they become or what would help them become employees at University of Maryland and all the great stuff that you do.
Ah, pressure, pressure, pressure.
None whatsoever.
Good afternoon, everyone. I'm Pamela Johnson. I'm a career coach at the University of Maryland Medical System. I'm a part of a team that do community engagement and workforce development. I work with a team of it's about maybe 8 of us. I'll say 10 at the most. So, my role here as a career coach, I get the opportunity to work with the people in the community, like yourself, that are participants at BOC, other community organizations, as well as community colleges. So, I get to work with you guys in helping you find employment here at the hospital. And then I also have the pleasure of working with our incumbent staff who are working here currently at the hospital, people that are in roles such as nursing support, like your CNAs, PCTs. I'm in charge of also the admin staff, our unit secretaries, our medical assistant staff, as well as farm tech staff, all of our perioperative staff, search techs, central store processors. So any frontline staff member that are entry level, I'm their career coach. And so I get the opportunity to help engage with them in things such as workplace challenges. That's the least fun of my job when I have to reach out to a staff member because their manager has asked me to speak with them about workplace challenges. Our biggest workplace challenge with our staff members are time and attendance. So we have a lot of staff that have, challenges getting to work on time because they have families, and then sometimes life just shows up. And so they may not always get to work on time. So that's one of my roles that I act as their career coach, as well as helping them with barriers. I've helped people with food insecurities, home, like I won't say homelessness, but to prevent them from being homeless. So I'll provide like rent resources for them, childcare. That's our biggest thing with staff members is helping them find childcare because they have to be able to come to work, so they have to make sure that their kids are, at childcare. Just anything, financial literacy. I'm like their own little research guru, and I help them with their educational goals as well. So I do a lot. My days are busy. And sometimes I sit in my office, I'm overwhelmed. I'm like, what do I start with first? And then, of course, I have other projects that I'm juggling as well as a career coach to hundreds of people. We're the University of Maryland. I'm located at 22 Green Street downtown, which is our main hospital. We have about maybe 12 hospitals in our system. So I'm the career coach for two of our locations, University of Maryland downtown campus and Midtown campus, which is right up the street from our main hospital where my office is at. And so I'm responsible for the staff members at Midtown as well. University of Maryland Medical System, we've been around for, God, for like over 200 years. I think we just celebrated like over 200 years. That might have been like 2 years ago, but we've been around for a long time. We are a educational hospital. We have a lot of students from different colleges come in to, do their intern or externship experiences. Big, really big with nursing. We have a lot of nursing students from different various colleges within the state of Maryland come here as well to get their experience for school. And so we are kind of at the top as far as hospital care. We have won a lot of awards. You can go on our website and just look at the numerous awards that we have won, things such as cancer, children's hospital care, pediatrics. So we're really big and we're well known. Just a little bit about my background. So I got into healthcare about 4 years ago. So I had been working in nonprofit, as a job developer, also as a career coach. And so about 4 years ago, right after COVID, I decided to apply at the University of Maryland. And so I had already been working with some people within the organization. So I kind of sort of had a network, which that helps as well when you're applying for work. So like if you have me for your network, that could like open up doors for you getting in the hospital. It helps a candidate that are looking for work. So I already kind of sort of knew some people here that was working here. And so I applied for the position and got the interview, and I started 4 years ago at our hospital called University of Maryland Rehab and Ortho Institute. So I was a workforce development specialist there. And then I decided to transfer and come downtown. And so I've been here, my anniversary date will be at the end of this month. I've been here 2 years in this program. And so I'm glad that I came. It gives me a chance to work with really way more people because Kernan was a smaller hospital. And so down here it's a much larger hospital. So I'm able to work with a lot of people, and that's what I love doing. I love helping others. So down here I get to help more people than where I was at. So I know it sounds crazy, but I love hard work. I love working hard and working and helping others and improving their lives in any way that I can. As a career coach, it gets challenging because I do come across a lot of candidates that are interested in working in the hospital. And a lot of times those candidates are not considered as a qualified candidate because they may have not prepared themselves, such as they have an outdated resume. They didn't follow instructions when it came to the application. Their application may have had grammar errors on it. So you got to be very careful when you're applying for positions. A lot of times, and I get it, people think that they can do everything, but I'm a career coach. So what do I look like applying for a surgeon's position here at the hospital? So you got to make sure that you are qualified. The candidate needs to make sure that he or she is qualified for the position. So with that comes researching the position, reading it, making sure that you have what that job description is asking for, because a lot of times we have candidates that will apply for things. They say, "Oh, Miss Pam, I could do that. I have a degree." I'm like, but it's asking for a little bit more than just your degree. So you have to make sure that you are qualified for the position that you're interested in. And then outdated resumes. I get a lot of resumes that I'll look at them and I'll say, "Oh my God, this is outdated." And so you got to make sure that the resume is updated, and because that's very important. And then filling out the application. Once you upload your resume into the portal, the application portal, it populates. So it kind of sort of help the candidate with completing the application. It can go really quickly as far as filling it out, but you got to make sure that the application doesn't have any grammar error, spelling errors, and so forth. And most of all, make sure that your resume matches what that job description is asking for, because a computer scans your resume. It scans the candidate's resume and it looks for certain words based on that position that the candidate applied for. So it's going to be looking for certain keywords, but we call them buzzwords as well. So if your application and resume don't have those words on them, then that is a way of getting you disqualified for the position.
Quick question for you.
Yes.
So what if a candidate, has all of those things in order and they make it to the interview level, what what kind of guidance can you talk about as far as how to conduct themselves in an interview, how to prepare, those kinds of things?
That's a good question, Ms. Sharon. So when a candidate is getting ready for the job, okay, say they did the application and the manager looked at it and they say, hey, we want to bring you in for the interview. From day one, you have to sort of act in a professional manner. Even when you're sitting in front of the computer completing the application, you have to have the right mindset. So, because it starts with the application. So once the candidate completes the application and then they get the interview, you must prepare yourself for the interview. That involves maybe going through a mock interview with someone, reading over some interview questions, practicing the questions, having someone ask you some questions and then you answer them and they give you feedback, making sure that you have proper attire. So the way that they do interviews here at University of Maryland, your first interview is a phone interview. So you want to be careful, even though you're on the phone and it's kind of like a relaxed type environment versus being virtual or in person, but you still want to make sure you're prepared because they're listening to how you're answering the questions. And so I've seen a lot of people that did not get past the interview on the phone. So what they do is they will screen you on the phone because they don't want to waste the manager's time. They don't want to waste your time if you're not the right fit for their manager, because these are our talent acquisition personnel that are calling the candidates. So they will screen you over the phone, talk to you for a few minutes. And if they feel like that you would be that good fit for their hiring manager, then you get passed on to what they call the in-person interview. So even as I was saying a few minutes ago, the phone interview is very important because you want to be careful how you answer the questions, what you tell that talent acquisition personnel, because you're trying to get to the next step, which is the in-person one. And so I know a lot of times people tend to get a little lax because they say, well, I'm on the phone, but they're listening to what you're saying. They can't see you, but they can hear you. And trust you me, they are listening and paying attention. So say that the candidate gets to the next interview, which is the in-person one. And we all know that's a really, really important interview. And sometimes they may offer it virtual. And once again, people feel like, oh, this is virtual. I don't need to make sure I look appropriate. But you do need to make sure that you look appropriate. You need to make sure you have the right facial expression. You need to make sure you have the right tone because they're looking at all of those things. And then say you come in for an in-person interview because you may come in person. The manager may say, I don't want to do a virtual one. I want to see this person in person. And then you definitely got to make sure that you're really put together because you're face to face in person with that manager. So make sure that you have like I say, proper attire. Make sure your hair is groomed. Make sure that you have proper hygiene. All of those things are important. And I always tell people that the first impression is a lasting impression. So even if you come in the door and say the hiring manager's admin person may be the first person that may greet you, because some of the managers do have admin personnel on their units, and you may come across that person first. Always make sure that you greet the person with a smile. You have a professional tone, you have the right, attitude, because that personnel gonna go back and tell that manager, well, when she encountered me, she was this way or she was that way. And so that kind of sort of may influence the manager's decision whether or not they want to bring you onto the unit on their team. So you got to be careful with that.
One of the questions that I often get is what's considered to be proper attire when interviewing in the healthcare environment. Specifically, they always ask about scrubs and those kinds of things.
Wow.
So
I've seen it all. And I can tell you that scrubs, they do consider scrubs. So if you have a student or a candidate that is already in the healthcare field or taking a course in the healthcare field, that's fine. They can show up in their scrubs. That's acceptable. But if you have a candidate that is not along the lines of don't meet that qualifications, then they want to make sure that they're wearing, I always say like a white shirt, maybe black bottoms or navy blue or tan, and nothing revealing as far as the women, nothing really tight as far as the women, making sure that they have their hair, just combed. They can wear braids. Braids are acceptable. And then if they are chosen, I know hair color, it gets a little bit more deep into the hair coloring if they are accepted the position. But once again, I've seen a lot as a career coach. When I go up on the units, I've seen pink hair, I've seen orange hair, I've seen purple hair to support the Ravens. So I don't think the managers are making a big deal about the hair coloring. But yes, I've seen a lot. And then with the guys, making sure that your hair is groomed. Once again, lots, braids are accepted, but just making sure that they are, contained. Like if they're long, put them back in like a ponytail or something, making sure that they have their hygiene. Once again, the guys, white shirts. I always say, be safe, do something, white, light tops, and then like a navy blue, a black, or a tan bottom. If they decide to do a pattern, not nothing too wild, but I've seen a lot. Even people that have came to our hiring events, I've seen them in like these patterns, like zebra patterns and stuff like that. Try to stay away from that stuff. Just keep it simple.
Thank you, Ms. Pam, for the overview
Welcome.
and some good tips around candidates being prepared. So could you give us a snapshot or overview of the types of career opportunities that are currently available with University of Maryland Medical Center? And could you identify which entry-level roles that are most accessible for new candidates that are just getting in the healthcare industry?
Okay, good question, Jermaine. Sure. So currently, I did go on our website because as a career coach, I have to go on our site from time to time because, like I said, I do assist people with finding employment opportunities. So I found 5 roles that we have that may be a good fit for your participants. I'll go through and I'll do the top level ones first and then the entry level last. Because I know a lot of people tend to like, when you talk entry level, they're like, All right. So we have a patient and family care liaison position. And so that position is only asking for a high school diploma, GED, good customer service skills because you're working with the family and our patients. And so, yeah, just good customer service skills. So you would think, listen to that role or that title, you thinking like, oh, wow, that person must have to have a degree, but they don't. And then we have a residential counselor position for evenings. So that's a person that more so into maybe like mental health. Like you gotta, I won't say mental health, I'll say you'll be working with mental health patients. And so they want to make sure that you're able to problem solve, you're able to deflect, like if a patient is going off. So you got to be able to resolve conflict. And so that position is only asking for a high school diploma or GED as well. And then this is one of my favorites. I work with this staff here at the hospital, facility admissions coordinator. So that's the person that's doing like more admin role. You're dealing with the patient's information. Surprisingly, it's a certain certification you got to have. I cannot think of that certification off the top of my head. So I just want to tell the candidates, whenever a job description says preferred, it means that that's what the hiring manager prefer, but you don't have to have it. So if it says it's required on the job description, then that means you have to have that certain, whatever that skill set that hiring manager is asking for. So for this particular, I think it's kind of sort of like, I want to say it's like a clerical type certification because you're doing a lot of computer-based stuff for this facilities admissions coordinator. But it said preferred. And so you're once again dealing with the patients, you're dealing with their families, And so they are coming in and you're admitting them. So think of the role in the mindset of you're admitting the patients. Getting to the entry level. I like the entry level. A lot of times, candidates that are searching for employment here at the University of Maryland, when we talk about the entry level positions, it doesn't get any, sometimes it's not welcome. We also always have meal attendant positions in our food service, and we have, of course, our famous housekeeping positions. And I always tell candidates that housekeeping is an excellent place to get started if you don't have any healthcare experience, or maybe you haven't worked in a while and you're trying to get your foot in the door at a hospital. Housekeeping is the perfect place to start. And I always also tell people that housekeeping, if it's not for housekeeping, then we wouldn't have a hospital because their role is very vital. They're responsible for keeping the hospital sanitized, germs free, which is, that's important for a hospital setting. So of course we know candidates that have experience in healthcare, they have certifications. We all know that those are strong candidates. Don't get me wrong, for a healthcare setting. It makes sense, right? Because you're working in a hospital, you're working with sick people. So if you're a CNA or you have phlebotomy or something like that, that makes sense. But listen, it's a hospital. We have all different types of other roles within the hospital. We have IT, we have finances, we have social work, we have case management, we have counselors. So it's a good place for a person that's interested in healthcare to, have a career.
Thank you. That
Welcome.
information is very, very helpful. Giving the perspective from just not from the clinical or patient employment opportunities. I did want to shift and talk a little bit about employee attitude and behavior as it relates to the culture of the workplace. I was speaking to a candidate recently who was talking specifically about having challenges in the workplace because of things such as that's not my job, or being asked to go to different units and that not being where they were hired, and that their resistance to that was identified by their manager as being not a team player, as being insubordinate.
Of course.
And they could not truly, I'm going to use the word understand, because skill-wise, patient care-wise, they're doing their job. And so could you talk about that a little bit and how that shows up in the form of professionalism in healthcare?
Sure. So as a career coach, once again, I get to see all of these behaviors because I work closely with staff and the managers. So I hear from the managers these same complaints from them regarding the staff's behavior. So I'm going to say, to work in healthcare or probably on any job, this may apply to any job, the first thing you must be is flexible. You got to be flexible because you can't go into healthcare thinking that, okay, I'm doing my job, what I was hired for. This is the job description that I'm following because this is what they hired me for. But it's healthcare. Things come up. So you got to be flexible with an open mind, of course. You have to be flexible. So you have to be flexible for when your manager say, hey, we're a little short staffed today on this unit, cardiac unit, because I work with that staff on our cardiac unit. And so you got to be able to be open-minded when she come to you and say, hey, we're a little short staffed on the cardiac unit. Can you please go over to this other unit that she's also the manager and in charge of? And you have to be willing to do that. You have to have an open mind, expose or display attitude. And so managers are looking for staff who are flexible, open-minded. Team player is number one because you're working with tons of people on a team, and you have to be able to work with each and every person. You have to be able to communicate with them because you're trying to work with this team so that you can get the job done. So I would say team player, effective communicator, flexibility, open mind. They don't like staff with attitudes because you're in healthcare. You're dealing with someone who's sick. Do you think that's fair that the patient is hearing your attitude? You going back and forth with your manager because she asked you to go to another unit and so to help out. So no, I mean, you know, you're working with people that are vulnerable. They're at their lowest point. I've had to coach staff who were cursing on the units, like just cursing. It's just unbelievable. So you want to make sure that you exhibit professionalism. We all know that, and we all do it. Like I'm one way in my office at work, and then at home, I'm somebody, you know, I'm more relaxed. I could be a little bit more myself. So that's the thing about working. It's almost like an actor or actress. We have to turn it on and turn it off. So you turn it on when you're at work, that professionalism, the appropriate behavior, making sure that you're communicating appropriately and doing, you know, those duties and also other duties as assigned. Because I'm asked things that I'm like, why am I doing this? But at the end of the day, my manager asked me to do it, and so that's what comes with working. So we're like actors and actresses, those who are in the workforce and working on these jobs. We have to, you know, act while we're at work, and then when we not at work, we get to be more of who we are. Now, I get the question like, well, are we really being true to ourselves? I know because my 20-year-old, he asked me that, so you being phony. I said, no, I'm not really being phony. I'm doing what I need to do in a professional environment. Why would I come in here acting like the person that I am at home, which I'm not that bad of a person, but you know, I'm a little bit more relaxed at home than I am at work. Yeah, that's the thing with the younger generation. They feel like they should be open to just be who they are. And I'm like, but this is not your job. If you're the CEO and the owner of this company, then yeah, maybe you could do some of the things that you think you can do, but you're on someone else's job. And so you gotta go with the flow. You gotta be a team player. You gotta be flexible. You gotta be open-minded. You can't give your managers a lot of flack in, maybe I shouldn't use the word flack, but just come out and say it. You can't give your manager attitude. That's just not really good on the job.
So thank you.
Ms. Pam, what does the
Yes.
ideal employee for University of Maryland look like?
Oh wow, someone that is the opposite of those things I just said. Team player, and I left out also working in healthcare. You work long hours, so you may work 12-hour shifts. So you may be at work from 7 a.m. to 7 p.m., 7 p.m. to 7 a.m., vice versa. So you're going to be around a team of people for 12 hours. And so they're looking for someone that is, you know, able to work 12-hour shifts on time. I left out being punctual. And so, yes, on time. And here I'm dealing with a lot of challenges as far as punctuality. A lot of our staff members struggle with that. And sometimes life do show up. You know, it shows up out of nowhere. You just coasting along, and then you look up and your car won't start for the day. And so I always tell my staff members, anytime life shows up, you want to communicate with us, with that charge nurse or your manager as soon as possible to let them know if you're not going to make it in for your shift. But getting back to your question, Jermaine, I know I got a little off with the sidebar, but the ideal candidate to work here is somebody that is going above and beyond. They are on time. They're at work, not taking off with their PTO on time because we have staff that takes off time. They want you present because you're relieving other people at the beginning of the shift. And then they want somebody that takes the initiative. They love people that are leaders. So if you come up with the idea, the one thing I can say at this hospital, the managers, they're open to your ideals. So say you're a fresh candidate and you got hired and you're newly employee staff and you present ideas to your manager, they are open to it. I've talked to a lot of my nursing support staff that told me they implemented things on the unit, and I'd be very impressed with it. So they like leaders. They want you to help solve the problem, not be a part of the problem. And so if you come in here and you get hired and you're able to be a leader and take on the initiative at the same time being innovative, they love that.
Just to pivot a little bit into career pathways and long-term vision, at University of Maryland, what supports are in place for employees who want to grow and to specialize in those? And are those opportunities endorsed, say, by nurse managers and so forth?
That's a great question. So yes, part of my role is to make sure that people move to the next step or the next level. So yes, we have tons of community organizations that we work with, as well as colleges on the as far as community college level, 4-year college. The managers are very supportive. For example, Sharon, when I shared with them your trainings, they immediately responded back. So they're all for the staff member transitioning into a higher role. They want what's best for the staff member. So yes, we are all supportive of the staff member, like I say, transitioning from one role to another role in the hospital. Because if the staff member is happy with what they're doing, guess what? They're going to stay. And so we support that very, very much because we want the staff members to stay here. We want our retention rate to be high. And so part of my role is to help with retention and to keep staff members here. So yes, we're very supportive of staff members moving from one level to the next within the hospital system.
All right. Anybody else have anything?
What encouragement would you offer candidates who may be feeling a little intimidated about a healthcare career?
I would say tell that person to not be intimidated. I mean, look at me. I had never worked in healthcare 4 years ago. I had always did nonprofit. And so never be intimidated by anything. I love challenges. They just got to be encouraged. If they have like a support system, I'm sure you guys support your participants. Tell them to reach out to you guys for encouragement. I can talk to them to encourage them, but just never be intimidated. If they really want a career in healthcare, we have all types of careers here, even for those, like I said, that don't have that healthcare credentials. They can always start off somewhere entry level and move their way up. So never be intimidated. Just be encouraged, stay positive and surround themselves with people that are very supportive of what they're trying to do, which I'm sure Bach is really good with that, supporting the individuals in the community. So yes.
So what is the best way for interested candidates to get in touch or have access to the opportunities at University of Maryland?
So they can go to umms.org, and I think it's -jobs. And so they can go to that website. They can check out. I'll send a link to you guys as well. And then they can go on our website. They can look at all types of jobs in various areas. I'm really good via email. That's my best way of contact. If you want to connect one of your participants to me, email works really well for me. And I always tell the interested candidate to send their resume to me because I do like a screening of the resume first. And then I'll dive deep into giving them some suggestions of what type of jobs they should apply for if they need some guidance and a little push in that area.
Well, thank you, Miss Pam and University of Maryland for talking with us today and providing this wealth of knowledge and information for our participants, hopefully some your future employees. And so we thank you, thank you, thank you. And as always, we appreciate the partnership and the opportunities for collaboration.
Thank you. You're welcome. And the same here. You know, you guys are like family to us. And I appreciate the opportunity to share this information with your participants today. So thanks for having me.
Awesome.
Thank you so
Thank
much,
you.
Ms.
Thank you so
Pam.
much.
We'll
You're
be in
welcome.
touch.
Yes,
All right.
ma'am.
Bye-bye.
Bye.